What's your full name?
Naomi Aduku.
Oh, your name's so pretty.
Thank you.
As pretty as she looks.
Thank you.
And she's from Bastion
Health.
Bastion Health.
Yes.
And today we're going to be talking about health insurance and the importance of health insurance, and also what Bastion, have in store for you. Why you should pick them over any other organization out there. All right, so let's talk about what's the importance of health insurance, and why should everybody out there have it?
Okay, thank you, Kafayat. Thank you, Inspiration FM, for having me today.
It was a pleasure.
I'm absolutely excited to talk about this topic, which is very, foremost on my mind. So really, the WHO has continued to push for, universal health coverage. And all that means is that, it is important that everyone has access to care such that they don't, encounter any financial hardships.
Yeah.
What has happened is, people fall sick, they're going to hospital and paying out of pocket. And honestly, it can be catastrophic to, your finances when you have to, embark on that. In Nigeria today, we have just about 3% of Nigerians covered by, health
Why do you think that
insurance.
is?
The truth is, I think one, there's a lack of awareness, and two, there are issues around trust. So,
people, you're not a very trusting people.
Absolutely. So, I mean, we have to create the awareness, and we also have to ensure that trust is built. That will take a bit of time, but based on the things that we do and based on the fact that people can see these things being done, I think we'll be able to build trust as we go along.
What do you think are the things that one can start with to start to build that trust? Because we have to, with the whole cashless policy and everything that is going on.
Absolutely.
It has totally crippled the health system, because if you're going there, if there's an emergency case and you need to attend to somebody now, it's a life and death situation. If you don't have cash, they probably won't attend to you.
Absolutely.
And something that you could, a situation where the person could have been easily saved will now turn fatal, and the person will lose, their lives.
So the thing is, I mean, once you have a health insurance cover, which is what the HMO, like myself, Bastion Health, provides,
yes,
you're able to walk into a hospital, and show that yes, you do have this cover, and then you can be attended to. But it's important that there is transparency in the process.
Okay.
So it's important that for people who do buy this health insurance, they know what they're covered for. They understand what the plan is or what the benefits under those plans are, so that even when they go to the hospital, even if they're being told otherwise, they know that this is what I have and this is what should cover me when I get there, and the hospital will attend to you in good time. So I mean, these are things that build trust, and these are areas, in terms of course, the service issues that we might face that we do have to address, which is around transparency.
Thank you for taking that word, because that was in fact, that's actually my follow-up question. That I think one of the reasons why Nigerians don't really trust and want to get health insurance is because of the lack of transparency.
Correct.
You get your insurance and they tell you this and this is what it covers, and then it finally happens. They say no. They always find a loophole or one fine print somewhere that says, oh no, I'm sorry, it doesn't cover this operation, or it doesn't cover this, or it doesn't cover that.
Correct.
So
I mean, for Bastion Health, what we have done is create that transparency. Today we have a mobile app where truly, if you if you have that mobile app today, it can show you clearly what your plans are, what your benefits are on the app. So even if you went to the hospital and someone was saying, but I mean, these plans and benefits vary across the different kinds of plans that we have.
Yeah.
So, but you can see it clearly. You understand? So where you open that app and you see those issues written out, spelt out boldly, and you know that this is what you have, it creates that transparency and that trust that we're talking about.
Wow.
Then that does help. I also want to say that we are regulated by the National Health Insurance Authority, which regulates the HMO space, and as at last year, I mean, there's now a new act which stipulates that every Nigerian, be covered by health insurance. So it now makes it mandatory that every Nigerian has health insurance.
Oh.
I think that's a step in the right direction as well, where there is more uptake, because there is a regulatory backing towards it. And that would also help to, increase the penetration rate of, health insurance. But it's also important that as HMOs, like myself, with being able to ensure that accessibility is there from day one once they sign.
Okay, so let's go to Bastian now.
Yeah.
Tell us why people should come to you. What exactly are you offering that is totally different from all the other
So for Bastion Health, we've built a very robust technology, and the watchword for us is convenience. How do we create convenience?
Life. I like stress.
Flexibility. So we're offering people healthcare at their pace, at their place, and at their price.
Oh, you have to say that again. I didn't hear the way she said it. Oh, say it again.
Absolutely. So we're offering people healthcare at their pace, at their place, and at their price.
Oh, nice.
So we create that flexibility across our plans. I've talked about transparency. So we've automated a lot of processes that ensure that certain gaps in the industry are addressed. We have gaps in terms of service. You go to the hospital, you wait for even before they actually get access to the HMO that you are signed on to.
It's frustrating.
So we've created an automated process where the pre-authorization codes are issued immediately. The hospital keys in your MOA
you skip
ID.
the waiting process.
Yes, so we've created that, so we've cut out at least 30-40 minutes wait time. So the hospital, because we've integrated with a lot of hospitals, on the technology side, we have integrated our APIs. We really do not have to, wait for the hospital to call us or send an email. So we've cut that out. We have a 24-hour multi-channel multi-channels across our platforms for us to be able to engage our enrollees. That's one of the things we've done. We have a wait time monitor, and then we're also trying to push consumer behavior to be different. I'll say this in terms of course, pre-appointment booking systems. How do you book your appointments? Honestly, Kafayat, if you were going to the salon today, you would book your hair appointment, of course, way before. So why don't we do this even when we're going to the hospitals, which we can do through our app, to book those appointments, and then of course ensure that once the appointment is booked, the doctor will see you as at that time, because you have already created a time slot, which is one of the things that is lacking. For Bastion HMO as well, one of the other things we've done is we've put your electronic medical records in your hands. So if you went to say Bauchi or Plateau State today and you had to see a doctor,
you can have
right on the on the app, you have access to it for you to be able to. It is your own authority, authorization that would let the doctor see it. So these are some of the things we have done differently at Bastion, just to be able to drive convenience, accessibility, and affordability.
Oh, she's good. So let's talk about the different plans that you have, because again, one of the reasons why people don't want to get health insurance is, it's too expensive. It's for the elite. It's for the rich people. I cannot afford it. Let's talk about
it. So we have a variety of plans across. We have plans suited for individuals and their families. We have plans for the SME space. That's a sector that has somewhat been overlooked. We have plans for the corporate space as well, and all these plans are tailored to fit these particular areas, and of course in terms of the pricing as well, there's a variety of plans. So across, we probably have, for the retail space, which is the individuals, we have about 6 plans, ranging from as low as 18,000 all the way to say about 50,000, 60,000 per individual.
So to fit everyone's pocket,
even to as much as 200,000. So it really fits your income levels, and then those benefits across, of course, and the network of hospitals. We have 1,800 hospitals. I must emphasize that, because that is also very important. That
across the country?
Yes, across the country, and you have access to roam across those hospitals within your network. So you're not just stuck to one hospital, and then we can ensure that, of course, those plans are tailored across these lines, so it meets whatever health issues or health needs that you have. So the benefits vary, and there are a lot of them, but if you go on our website, www.bastionhmo.com, you would see a long, a very detailed list, of course, of our benefits and the plans tied to all of these, the benefits tied to all the plans that we do have. But there's a plan for everybody that I can tell you.
Are you just in Nigeria? Are you in different African countries?
So today we're in Nigeria, but eventually we do have expansion plans.
Spread your wings.
Yes, because it's important that everybody has access to healthcare.
Yeah.
I mean, it's at the at the front burner for everyone.
Yes,
very important.
Yes, it is. So let's talk about some of the challenges that you face as an HMO. The major challenge to face your situation you've ever faced. Without what you'd like to hear.
So for challenges, sometimes it's still trying to get the enrollees to understand how the insurance mechanism and how it really works.
Yeah.
But where one of the things we're doing is also continuing to create or educate people about this, and this is one of the reasons why we're here today, to talk about how it works. But that is one major challenge, but I think it's something that we're working towards to overcome.
Okay.
But collectively, we can all do it, together. Yeah.
Okay, so the coverage has no age limitation, does it?
So there is an age limitation for some of the covers, which is from age 0 to 65 years.
Okay.
However, we also have a bouquet for the senior citizens, which is age 65 and above. Yes. Okay. We feel that they have also been neglected, and at that
Special
age you
treatment.
do have do have health issues.
Yeah.
And we've seen, of course, where people want to put their parents, their aged uncles, aunties, on health plans. So we do have a bouquet for that. Cater of people in society.
All right, fantastic. So how can they reach you? How can they reach you?
So you can reach us via email, which is which I had said before, which is www.bastionhmo.com, or you can call 0800 Bastion to purchase a plan from us. So we're reachable on those channels. And we're also physically present in several locations across the country. Okay. We have an office in Victoria Island, Lagos, and one in Yaba. Okay. And then we also have offices in Abuja, Port Harcourt, Kaduna, Enugu, Ibadan, and Maiduguri.
Yeah, all over the place. Yes. Do you have presence in social media?
Yes, we do. So our Bastion handle is
we need to spell Bastion so people know how to spell it.
BASTION.
All right,
so
Bastion.
Yes, Bastion HMO.
Okay.
We're on Instagram and also Twitter. So Bastion actually means fortress. So in the times prehistoric, or what would I call it?
Takes me to Game of Thrones.
Yes, correct. Where you had the fortresses. So the fortresses are called bastions. Yeah. And so that's what we're about, protection, because those were what we're put in front to be able to tell the people, oh, can we see people, the enemy is coming, or what is happening?
Oh, so she's good. Stop it.
So that's what we're about. Yes.
All right, that's cool. All right, so you can reach them on social media. You can also go, what's your website again?
BastionHMO.com.
Okay, BastionHMO.com.
Yeah.
And let's give out the numbers one more time. And can you give out the address in VI and the one in Yaba as well?
Okay.
So they know where it's
So
located.
number 1 Adiola Aduku is the Victoria Island address.
Okay.
And then we're also on off Herbert. That's Hughes Avenue.
Okay.
Yes. In Yaba. So that's where we are. Yes.
All right.
And then the number is 0800 Bastion.
Okay.
Yes.
Let's call the number again.
0800 Bastion. So let me call it out.
I think you should.
0800 227 8466.
Okay, let's call it again slowly.
Okay. 0800
Fantastic.
227 8466.
See, I'm dancing to the way she's calling out the numbers. Thank you very much for coming. It was a lot of fun. I enjoyed myself and I've learned a lot. And I'm sure a lot of people out there as well are more, they know a bit more about health insurance and the importance and the benefits. So
absolutely.
If you're interested, you can always reach out to them on social media, call the number, go to the office, visit the websites. You have all the information there. Thank you very much, Naomi.
Thank you, Kafaya. It was nice having you
here. I'm very happy that you came in, and I hope to see you again pretty soon.
Absolutely.
All right, and that is it today.